that, I'd like to hand over to our special guest presenter tonight, Dr. Nicola Fitzgerald of the PICCSI project. Nicola, you'll have to explain to us what PICCSI is.
PICCSI stands for the Pacific Island Cervical Cancer Screening Initiative, but we did try and it was a bit more of a backronym because we were trying to make a word that you could say wasn't too complicated.
Well done.
In the spirit of, clinical trials with cool names, we thought we'd try and make a project with a cool name too. So, so I just thought I'll quickly sort of go through a bit about what we do and how we started it and what it's about. But yeah, jump in if you have any questions. And it's probably a bit too long, so I've got a lot of pictures, so I'll just flick through them. But yeah, this is me. I work at the Mercy Hospital for Women in Melbourne, and I do a little bit of private obstetrics and gynecology as well. And I did some of my advanced training in Fiji and the rest of my advanced training in Warragul. So that was heaps of fun. And subsequently, I've done a bit of teaching in Samoa and Vanuatu and Kiribati as well. And certainly Kiribati is very eye-opening if anybody gets a chance to go there. We should probably take our project there, I keep thinking. So that'll be our next stop, hopefully. Just that. And I guess, when I give this talk, I normally say, well, this is the impression about what everyone thinks about the Pacific, that, lots of smiling faces and waterfalls and palm trees. And my experience is definitely that those things are all true. It's absolutely beautiful. The kids are amazing. This waterfall is in Port Vila. These kids, we just found playing on the beach in Tanna, and they were playing next to a stream that came down from the volcano, and they were cooking bananas in the hot water on the beach. It was so cool. And that's my sister and I on one of the beaches in Fiji. So definitely check it out if you get a chance. This is Lautoka Hospital in Fiji, and it's one of the tertiary referral centres. There's 3 in Fiji, and so this is one of them. This is where I did my training and my advanced training when I was a registrar, and so I keep coming back there. This is a photo of our labour ward, and it's a very appealing place to have a baby, don't you think? It looks lovely.
Maybe there's more paint in this one, I must say. Yes.
They have subsequently repainted it, but I just like the photo. This is the part of the labour ward as well. So the labour ward in Lautoka has 6 beds, and when you feel like you need to push a baby out, then they take you to another room. So this is the room where you can push a baby out, and you're sort of by yourself. There's another person on the other side of the partition, but it's slightly more private, slightly. And I like this picture because the midwives have a poster up about how you need to swab the perineum, which of course we never do back at home. This is just a picture of antenatal clinic at Lautoka Hospital. So lots and lots of women. Looks a bit more chaotic than the one at the Mercy, but not very much more chaotic. And these are our lovely midwives who wear a delightful costume, nurse's outfit. And I took this photo a few years ago, but they all still wear these nurses' uniforms. This is our postnatal ward at Lautoka Hospital. And this is the postnatal ward in Kiribati at the main centre there. These are some babies that I delivered. The mums are just so excited and stoked to have their healthy babies.
Yes.
And I delivered this little baby as well. We delivered her at 28 weeks, and she's the only baby, or at least when I was there, she had been the only baby that survived at 28 weeks gestation. So her parents were pretty thrilled. Yeah.
Yeah, well done.
That's the same baby. This is just me with the midwives. This is the operating theatre at Lautoka Hospital. All reusable equipment. And this is Vanuatu. So I've done it. I did some work in Vanuatu, and we've done some cervix cancer screening in Santo. And that's sort of part of how the PICCSI project came about. Is that I came to Santo after I finished my specialist training, to work with an NGO there called Medical Santo, and they do a really great job in northern Vanuatu and look after a lot of the islands and provide basically free medical care there as well. So I thought, great, I'll get involved. We'll go to Santo. We'll screen some women for cervix cancer. And it was incredibly frustrating. And I'll show you the place that we went to. This is Champagne Beach. It's one of the most beautiful beaches I've ever seen. And just, you know, a kid in his canoe there. This is a waterhole in Vanuatu as well, in Monsanto. So definitely worth a visit. It's so beautiful. And this is a volcano on Tanna. Oh, these are the kids cooking their bananas in the hot springs there. This is the labour ward at Port Vila Central Hospital, the postnatal ward and the delivery room. And the picture here is the operating theatre in Vila and the labour ward and the delivery bed in Santo Hospital. So it's just up the road from the NGO clinic that I was working at. And this clinic, so Medical Santo sent us to another island called Umbai, and this is their hospital. It's called Nduindui, and they had no running water and no electricity. It was a very challenging place for everybody to work, I think. And these are some of the pictures from the hospital. So people were so always amazingly lovely and friendly. And I think this was the dental chair. I think that's what it was. It looks a bit creepy to me, but anyway. So we went to this hospital and did some pap smears at the time. And, you know, we screened 120 women or something in a couple of days, and did all their paps and sent them back to Australia and got their results, you know, 3 to 6 months later. And there's no way we ever could find these women again. It was the most ridiculous thing that we ever did. And so I really thought, well, you know, if we're going to do this, we need to be able to give people their results, and we need to treat them straight away. Like, it's such a difficult thing to do, to go back and find these women who live on farms and in the middle of the rural areas. They don't have phones. They don't have any money. How are we going to do this? You know, the way that we were doing it was absolutely stupid. If they needed follow-up, they needed to go over to Santo, which is another island, and it cost them $40 on the boat, and they didn't have $40. So it was just a bit of a lesson in futility, really. So this is when I started to think about how can we do this better. So I was going to go through a little bit about health women in the Pacific, but maybe I'll just skip through to what we've been doing. I don't know what people are interested in.
No, very, very fascinating. It's interesting that you learn even though the initial attempt to do the screening and chasing them up 6 months later obviously wasn't a great success. It was actually a key learning point.
Yes, yeah, no, it really was. And we have the same challenge in Fiji, not quite the same as in Vanuatu, but, you know, you can never follow people up. It's crazy. You have to really hunt them down. You have to send someone to go to their village and ask their husband if they're allowed to come for treatment. And it's just a nightmare trying to follow women up for whatever reason. So we decided that really point of care testing and treatment is the way to go. So that's where the PICCSI project came in. So basically what we've been doing, and what I'd really like to expand a bit to other countries, like I'd love to go back to Vanuatu and actually treat these women, you know, find them and treat them, or to go to Kiribati and do it there as well, if we could, you know, if we can get the funding for it.
We're doing a little project in Tanna. Is it Tanna?
Yeah, yep.
Which is very famous because that's the place where they worship Prince Philip, or did worship Prince Philip.
Oh, yes. Yeah.
Anyway.
Yeah,
but,
hilarious.
Anyway, so there's a link of a charity based in Queensland that's got a link to Tanna, and we're sort of partnering with them around that. So we're going to learn a bit more about Tanna as well in the near future.
Oh yeah, Tanna's a really, really interesting place to visit. It's very rustic.
Right.
It's great. It's fantastic. The people are so nice. And the volcano is amazing. Obviously, like that photo that I showed you before, we took it. So it's pretty. You can stand up on the edge and look in, and no one will tell you that it's you know, you can't go there because it's not safe. You can just walk straight to the top.
Nicola, can I ask a question? I'm interested in how the patriarchal sort of structures of society have influence on women's health and pregnancy outcomes.
Yeah, it's tricky, isn't it? I guess just generally in health outcomes in most of the places in the Pacific are really dominated by a few things, and in particular, if the women are thought valuable enough to spend money on, that's one thing. If it's felt that they can be spared from looking after their many children, that's pretty important. A lot of women don't come to the hospital because they're worried about what's going to happen to their kids if they come, because their husband's not there or there's no one to look after them. And transport's been a huge issue because some of them live in rural areas and it's expensive to pay for petrol to come into town. So, you know, you don't necessarily come in if you don't have the money to pay for petrol, or you have to get on the bus or something like that. And perhaps your husband really doesn't agree that you need to come in for care. So it really affects all parts of health, and in particular, emergency care. So I think it's one of the reasons why women die a lot from ectopic pregnancy, at least in Fiji, is because they can't get to a hospital before they're dying, basically, which is really upsetting. It's definitely something that we saw when I was there. Yeah, so a bit of education will hopefully help, and it's also big. One of their big issues is gender-based violence, and so we're certainly trying to change the culture, but it's hard going trying to change culture. Yeah, let me see. Yeah, so I guess you probably all know about the low-income countries and delays in seeking care and receiving care, and that's certainly what we see in the Pacific. The other delay is often when they get to the hospital that no one knows how to look after them. And definitely in rural hospitals, that's the case. They'll get there and there's an intern who won't recognise that somebody's, bleeding to death. And even if they do, they can't operate on them. They can't fix them. So it's really tricky. So I had just a little bit of information about what women die from. So this is the maternal mortality ratios in these countries. And I just put Australia and New Zealand down the bottom just for comparison. Certainly Timor-Leste and PNG have, some of the highest perinatal, maternal mortality and perinatal mortality ratios in the world. And definitely the other places in the Pacific, their MMRs could be improved potentially. The other thing that women die from is diabetes, breast cancer and cervix cancer, heart disease and injuries. Melanesia, which is the area around Fiji, has high rates of breast cancer, and I think probably that's because of detection as well. Fiji probably has the most well-resourced health system of the Eastern Pacific, and so probably diagnosis is helpful there. That's just a little graph that shows the incidence and then the mortality from breast cancer around the world. And Micronesia is here, and Melanesia is here, and so they're parts of the Pacific.
Okay.
Just to give you a bit of an idea, and I've got one for cervix cancer as well. And I guess cervix cancer is sort of my area. So basically the women in the Pacific, have a much higher chance of dying from cervix cancer because they don't have cervix cancer screening, and the women are exposed to HPV early, and there's no testing, and in a lot of places there's no treatment for more advanced cervix cancer either. So it makes it really tricky, and the women are young and they've got big families, and so it's really upsetting. Generally cervix cancer is caused by this virus called human papillomavirus. And so one of the things we can do is test using a PCR machine is test for it on the spot. And so that's what we've been doing as part of the PICCSI project. This is just a graph that shows you the incidence and the mortality from cervix cancer around the world as well. So Australia is down the bottom there, and Melanesia is the top. And then other issues regarding, gender-based violence and pay and poverty But anyway, so this is how we got started. So I was working and keep bleeding until they die. It's really awful. And so mostly we ended up just telling them that we couldn't do anything for them, which is really upsetting considering how close we are to Australia and New Zealand, and tell them, go home and, eat lots of vegetables and lots of iron, and that's all we can do. And so it's really upsetting. And, I certainly remember telling lots of women with little kids around that this was what was going to happen to them, and it was horrible. So I thought, well, maybe we could do something about it. So I thought, right, well, I'll organise some screening. I'll take some friends with me, and we'll try it out when you're 30 weeks pregnant. So that was that was the first trip that we went. And so I took a group of my mates from work, and we planned to screen women for HPV on the spot. And then if we found HPV, then we would treat them. So health centre each day, and we've still been doing that, and it's been really good because the women find it really difficult to access care in Lautoka, which is the kind of main tertiary referral centre in the West, and it's difficult for them to drive 3 hours in the bus to seek medical care. So it's nice if we can go and do it where they live. So initially we spent about $33,000, but we've made it a bit cheaper since then. So I think maybe we spent about 25,000 the second time, and maybe about 20,000 the third time. So a bit more efficient. We changed our protocol a little bit, which means we need a bit less equipment. And when we first went, the HPV positive rate was about 7%, and it's been pretty similar each time. I think the second time was about 10%, and our most recent time was about 12%. I think that's possibly because the test is getting more sensitive, not because the incidence is changing, but I'm not quite sure. So this was just there's a nice picture of Michael down here. Just a picture of our run Melbourne the first time we went.
Yeah.
So
I can see Rachel. I can see my wife, Jean.
Yeah. And we didn't die, so we were happy. And it was beautiful weather, so that's good.
Yeah.
So this is just some pictures of basically of us getting ready to run the project. This was our gang. This is our project meeting. As you can see, it's a terrible venue. And this was the first hospital we went to. This is Tavua Health Centre. And so we just took 25 volunteers on the bus and went to antenatal clinic and screened. We screened about 80 women that day. We went to, this is a health centre just outside Nandi. And similar thing. I just thought I'd put some pictures up so you could see what it was like. This is our admin team, and checking the women in, just getting their details and things. And these are some women waiting for their results. There's Rachel, if anyone knows Rachel.
Yep, Rachel. Yeah, she's on the board. Yep.
Yeah.
she's an apology tonight. There was another meeting on.
Oh, this is Tavua Health Centre again. This is one of our treatment rooms at one of the hospitals. As you can see, it's very high tech. And this was at Reki Hospital. They let us use their operating theatre. So this is the operating theatre that we set up as kind of a makeshift gynecology clinic. This is a gang of midwives that I brought from my hospital who were doing, at that time we were doing cervical cell screening on all of the women. So they're wearing head lamps so that they could do the speculum exams and they could see. This is our lab. These are our gene expert machines. So they perform point of care HPV testing. So it takes about 45 minutes to an hour to run through a cycle. So we just get the women to wait.
Very nice bowler shirts.
Yes. Yeah. So bowler shirts are definitely the way to go. More bowler shirts. Here we go. That's this again. And these are the women, we paid them to wave and make it look like they were having fun.
So, Nicola, you paid them to wave?
Sorry, I was just kidding. I said we paid them to wave and make it look like they were having fun. We didn't. They just waved for the camera anyway. And this is one of the health centres at the end of the day. So we, because we were screening, we screened about 80 women a day. We were there until right at the end. So this is just the sunset at one of the hospitals. It's my sister's baby, actually. She came with us the first time. This is Namaka Health Centre again, and the women waiting to come in and get screened. That was our team.
Right.
And these are just a few of we gave them some feedback forms so that, we could publish our data and say, yes, it was all, the women liked it and the feedback was good and it was acceptable and all that sort of thing. But they wrote some really, really nice things. So I just put a couple up. And my favourite one's this one at the bottom where they said they like our Colgate smiles. I thought that was really cute. Yeah. So just a bit of a quick overview about what we're getting up to over there. Cool. And this is my second favourite beach of all time. This is Port Orrery in Santo. Definitely worth a visit to this beautiful beach.
Yeah.
Cool. That's the end of my exciting talk.
Nicola, thank you for a wonderful presentation. I almost feel like
No problem.
I want to head off to jump in the water straight away. Such beautiful scenes and obviously a place of great work in a culture where certain things are not necessarily conducive to the best in healthcare, but a fascinating talk.